What is targeted therapy? Targeted therapy is one of the cancer treatment methods that uses drugs or other substances to identify and attack precisely to certain cancer cells. Targeted therapy may be applied alone or in combination with other treatments, such as chemotherapy, surgery, or radiation therapy. If your treatment plan includes targeted therapy, knowing how it works and what to expect may be beneficial for you to prepare yourself and make better informed decisions about your own treatment. Targeted therapy is designed to target cancer cells without affecting non-malign cells. Targeted therapy. Genes are smaller portions of the DNA that appoints the cell to carry out certain aspects. Cancer typically occurs from the disruption of the genes, thereby gaining pathological aspects such as growing and duplicating too quickly. Changes in the DNA varies according to the type of cancer. For example, different gene changes are responsible in colon cancer and breast cancer. Targeted therapy. Even among the patients with the same type of cancer, such as colon cancer, it may originate from different gene changes, resulting in differences among one colon cancer patient from another. In addition to that, the favorable environment that allows cancer to grow is not identical between different types of cancer. This variety acts as a starting point to novel, targeted, personalized treatment options. Drugs that target certain proteins or enzymes are specific not only to type of cancer but also the genetic background. They may block the growth signals or activate death signals on malignant cells. Targeted therapy drugs have a different adverse effect profile compared to conventional chemotherapy. Targeted therapy side effects. Some of targeted drugs have relatively minor side effects, while others may arouse serious conditions. These drugs may generate rare and unusual side effects. There are many different types of targeted therapy agents. The side effects largely depend on the type and the target of the treatments. Additionally, the seriousness of the same side effect may vary between drugs and patients. Targeted therapy side effects. Most of the side effects diminish after treatment is completed. The recovery time varies between patients. It is well known that some side effects of chemotherapy drugs may be permanent, but whether targeted therapy drugs cause permanent problems is not clear. Contact your healthcare team in case of a side effect to understand how long it lasts, and how serious the situation may get. Also, your doctor may give you some instructions or medications to prevent certain side effects to appear. Skin problems. A noticeable portion of targeted therapies cause skin problems. These problems usually appear over days to weeks after your treatment begins. It is a different clinical manifestation than drug allergy, in which allergic reactions begin abruptly, within minutes or hours of taking the drug. Skin cells have too much EGFR on them, just like malignant cells. EGFR is one of the targets in targeted therapy. The drugs that block EGFR signaling cause skin problems. They turn off the signal for skin cells to grow normally and make it harder for them to retain moisture. Skin problems. Debris. The rash begins as redness and swelling of the skin. About a month after starting treatment, the skin often crusts and becomes very dry, red, and fragile. Round, flat or raised red spots and pimples, usually inflamed, appear in the middle a couple weeks after. This may lead to skin infections in some patients. The rash may itch, burn, or be painful. It may or may not diminish on its own while treatment, but should diminish completely about a month after the completion of treatment. In severe cases, other parts of the body may be affected. Skin problems. Dry skin. It is a common side effect of targeted therapies. It may start within the first few weeks of the initiation of treatment, but almost everyone suffers from dry skin after 6 months into treatment. The skin becomes itchy and scaly, and even spontaneous cracks may occur, especially on hands and feet. Skin problems. Itching. Almost all of the skin changes cause itching. Red, painful cuticles, areas around the nails. Some medications may cause swollen, red, and painful sores on the fingernails and toenails. Nails may become brittle. The sores may look like an ingrown nails. It is not always easy to distinguish the sores from infections, and these areas are also prone to infections. Skin problems. Changes in hair growth. Some targeted medications may cause the hair to become thinner, dry, brittle, or even frizzy. Long-term treatments may result in bald areas or complete flaking of the scalp. Beard may grow faster. Changes in hair growth may occur in both men and women, including longer, thicker, curly eyebrows and eyelashes that may need trimming. However, facial hair growth may slow down in some men. Eyebrows may also be thinned. These are not usually happen right away, but you may notice them later as treatment continues. Sore areas may occur, and the scars originated from these areas may hinder your hair to grow back after the completion of treatment. Skin problems. Changes in hair or skin color. Targeted therapies may convert skin or hair a yellowish color during treatment. Hair and or skin may get darker and expected to regress when treatment is finished. Eye changes. The eyes may become dry and red. Burning sensation is common. Eyelids may get red and swollen, and both eyelids and eyelashes may become tender. Sometimes eyelids may turn inwards or outwards. Impaired eyelids or prolonged dryness may harm the exterior part of the eye, cornea. Contact your doctor or nurse to manage these changes to avoid injury, pain, or infection. Management of skin problems. Contact your doctor from the beginning of your treatment to prevent or control skin problems. A proper skincare before you experience side effects is beneficial to minimize problems. Use alcohol-free, perfume-free soft soaps, body washes, and shampoos. Take a bath instead of a shower and try oatmeal bath products to soothe your skin. Use cold or warm water, avoid hot water. Management of skin problems. Moisturize your skin at least twice a day with a softening cream that does not contain alcohol, perfume, or dyes. The best time apply moisture is right after the shower while your skin is still wet. Wear loose, soft clothing. Keep your nails short. Use laundry detergents or fabric softeners that do not contain strong perfumes. Stay out of the sun as much as possible. If you stay outside during the day, wear a hat and long sleeves. Use a broad-spectrum sunscreen with an SPF of at least 30. Management of skin problems. Do not use acne medications. Even if the rash looks like acne, acne medications won't work. They may dry it out and make it worse. If the soles are sensitive, use gel insoles. Don't wear tight shoes. Contact your doctor right away in case of a skin problem. Do not treat your skin with over-the-counter medications or stop taking your targeted medication without consulting to your doctor first. Management of skin problems. Contact your doctor right away in case following: burning or itching sensation, dry, flaky or cracked skin, soreness around nails, dry, red or sensitive eyes, eyelashes growing inward towards the eyeball, wounds on your scalp or other hairy parts. Your doctor may advise you to avoid exposure to direct sunlight. Even after the completion of treatment, you may experience sensitivity to sunlight. Management of skin problems. Minor problems. Minor changes include well-limited, non-infected rashes. Patients with minor skin problems may not need any treatment. Effective skin creams or ointments that do not contain alcohol, perfumes, or dyes may help with dryness. Moderate problems. Moderate problems include skin changes that cause mild distress by itching or pain but don't have any signs of infection. The skin can be treated with a cream or gel. Your doctor may also recommend an antibiotic to take by mouth. Drops or ointments may be given to help with eye problems. The dose of the targeted therapy drug usually does not need to be modified when skin problems are moderate. However, the prognosis of skin changes should be monitored closely. Targeted therapy. Other side effects. Hypertension. Targeted therapies, especially angiogenesis inhibitors, may increase blood pressure. There is nothing you can do to prevent it, but your doctor will monitor your blood pressure closely and use antihypertensive drugs when required. Targeted therapy. Other side effects: bleeding or blood clotting problems. Targeted therapies may interfere with the new blood vessel formation and lead to bruising or bleeding. Luckily, it is not common. However, being aware of them is essential, since they may be severe. Tell your doctor immediately if you vomit blood or anything that looks like coffee grounds, or if you notice dark or black stools or bright red blood in your stools. These may be signs of bleeding. Targeted therapies may also provoke blood clots in the lungs and legs, as well as heart attacks and strokes. Contact your doctor if you experience sudden swelling, pain, or tenderness in your arm or leg. Seek help immediately if you experience chest pain, sudden shortness of breath, vision problems, weakness, seizures, or difficulty speaking. These can be signs of serious problems caused by blood clots. Targeted therapy. Other side effects: wound healing problems. By inhibiting new blood vessel growth, drugs may interfere with wound healing. This may old wounds to reopen and new wounds to fail to close. It can also lead to holes, perforations, in the stomach or intestines. Contact your doctor right away if you experience excessive vomiting or stomach pain. Since some of these drugs interfere with wound healing, they are usually stopped before any planned surgery, including dental procedures. Contact your doctor right away in case of a surgery plan. Targeted therapy. Other side effects: heart damage. Targeted therapies may damage the heart. Possible symptoms of heart damage include chest pain, increased coughing, difficulty breathing, especially at night, rapid weight gain, lightheadedness, fainting, and swelling in the ankles or legs. Targeted therapy. Other side effects: autoimmune reactions. Some targeted therapy drugs exert their effects via removing the brakes on the immune system. If the immune system starts attacking the healthy parts, this may lead to serious problems in the lungs, intestines, liver, skin, eyes, nerves, hormone-producing glands, or other organs. Targeted therapy. Other side effects: edema. Targeted therapies may cause swollen face, especially around the eyes, hands, feet, and legs. It usually doesn't need to be treated, but in severe cases a diuretic, water pill, may be used. Targeted therapy. Other side effects: nausea and vomiting, diarrhea, shortness of breath or difficulty breathing, cough, fatigue, headache, hair loss, damage to organs such as the thyroid gland, liver, or kidneys, allergic reactions while taking for medication, increased risks of certain infections, second cancers.